Welcome to the Nursing Debates of 1968 Clinical Sessions. In our nursing society, debating has become an important means of acquainting the community on issues surrounding significant questions and problems. Certainly, debating is no stranger to business, law, legislation, and education. Recently, the political scene has seen a renewal of debating as a means of exploring an opponent's point of view. Nursing, on the other hand, has relegated the value of debate to the floor of the House of Delegates within parliamentary procedure. As a means to greater understanding of policies to be decided, parliamentary debate is most appropriate. Debating, however, can serve other useful purposes. Its structure is such that the participants are protected and the issues come to the fore. The advisory committee contends that the time is most appropriate for the profession to give some attention to current problems in the profession at a national meeting. We have made every effort to select carefully from three vital areas of concern to nursing: nursing education, nursing administration, and nursing practice. Unlike parliamentary debate, the debate panels are not policy making. Issues here will be explored. For example, this afternoon's debate concerns nursing education. Each professional nurse, no matter her specific functional area of practice, retains some concern for the practitioner being prepared to enter the profession. All our current educational programs preparing beginning practitioners have essentially the same goal: to prepare the student of nursing to become a beginning practitioner of nursing. No program can teach all there is to know about practice. What then is the beginning practitioner prepared to do? How much responsibility should the educational program assume, and how much responsibility should an employee agency assume for the beginning practitioner? Other professions which appear to have the same question have resolved it with a transitional, supervised practice period. Our debate panel today will explore some of the issues within a stated proposition structure. The proposition to be discussed at this session is resolved that all graduates of programs preparing registered nurses should have 1 year of internship. The affirmative team members who will support the proposition are Mrs. Emily B. Myers. The second affirmative speaker is Mrs. Joan Willis. These are on my right. The affirmative speakers on my right: Mrs. Emily B. Myers and Miss Joan Willis. Mrs. Emily Myers is Director of Nursing at Halifax District Hospital in Daytona Beach, Florida. And Miss Joan Willis is a staff nurse at the Denver Public Schools in Denver, Colorado. The negative team members who will oppose the proposition are, on my left, Mrs. Betty Irwin, instructor in psychiatric nursing, Vanderbilt University School of Nursing in Nashville, Tennessee. And the second negative speaker is Miss Georgine D. Chow, Director of Department of Nursing, Manatee Junior College in Bradenton, Florida. We will now begin our debate that all graduates of programs preparing registered nurses should have 1 year of internship. Mrs. Myers.
Madam Chairman, worthy opponents, and fellow nurses, my first very pleasant task is to say on behalf of my colleague and myself that we are very pleased and proud to be here this afternoon, and to tell you how grateful we are to the convention staff of ANA for giving us the opportunity to debate this controversial subject. The question is, be it resolved that all graduates of programs preparing registered nurses should have 1 year of internship. Let us begin by defining the terms. All graduates of programs preparing registered nurses we interpret to include graduates from associate degree, diploma, and baccalaureate schools of nursing. Should means that it is highly desirable. 1 year is a 12-month program to include 2 weeks of vacation. Internship means the planned and supervised clinical experience of graduate nurses in a hospital setting to supplement the academic preparation received in the School of Nursing to include service rotation. When nursing schools were first established less than 100 years ago, they adopted Florence Nightingale's pattern of being independent of hospitals. However, the attractions of staffing soon caused these programs to be taken over by the hospital institutions. Students worked as many as 60 hours a week, and in exchange were fed and housed and often received a minimal stipend. That 60-hour work week seldom included more than 10 hours of class. Most of the learning was in doing, and in those days, when the nurses' functions were clearly defined, the training period did produce registered nurses ready and able to continue in the normal patterns of nursing care. The post-World War II period has brought many changes in nursing functions, however, and this has resulted in many necessary changes in nursing education. We are coming to accept the need for a technical and a professional level in nursing preparation and in practice, even though definitions of these levels in nursing are not as clear-cut yet. Currently, clinical experience has largely given way to academic learning, resulting, we believe, in graduates who are prepared in theory, but who need close supervision and guidance for an additional period of time to acquire the degree of manual skill and dexterity which will permit the nurse to be a confident and competent practitioner able to assume her responsibilities as team leader and perceptive observer of both her co-workers and the variables involved in keeping patients comfortable and secure mentally and emotionally as well as physically. In the November 1965 Nursing Outlook, Dr. Lucy Sturm Young, Director of Nursing at McKeesport Hospital, McKeesport, Pennsylvania, stated, "New graduate of any program cannot emerge from student to graduate status, be placed in a new setting, and be expected to function without guidance." Now let's be specific about how academic and clinical experience has changed in diploma schools over recent years. In a representative diploma school, the 1954-55 incoming class anticipated 39 months in training. At that time, this school, established in 1882, was affiliated with a university program so that the diploma graduate could get her BS with 4 more quarters of study at the university following diploma school graduation. The 39-month program included 30 months of clinical nursing instruction and practice, of which approximately 3 months was classroom instruction. This leaves 27 months for clinical practice. Today, this same school has a 3-year program which overall is 27 months in length. And what about associate degree programs? These technical nursing programs state that they maintain a balance of both general and professional education with clinical practice. These are 2-year community junior college programs. In the one with which I am most familiar, the only actual patient relationships these students have come during the daily 2-hour clinical laboratory, which must necessarily be fitted to their class time, not to the patient's needs. Night and evening clinical practice is essentially unknown. In our hospital, we have found associate degree graduates most appreciative of the opportunity we provide for an internship, which gives the close supervision and supplementary teaching they feel they need. I quote in part from nurse intern responses regarding our program for them. One student stated, or young graduate, "During training, I had not had the opportunity to see or do many of the things that I felt I should have. I also greatly lacked confidence, and the idea of beginning work really scared me. Another one said, I like the assurance of knowing there is someone I can turn to when I have a question and know I'm not expected to know everything. A third one responded, as a student, you are limited in gaining new experiences, skills, and clinical knowledge due to the time element. This program has afforded us the opportunity to overcome these obstacles at a rate which is comfortable and with people who seem genuinely eager to help us. In the baccalaureate program, a sampling of students responded with an amazing 80% in favor of an internship program. This comment was made on one questionnaire. I get the feeling that practical learning is considered as something that everyone knows. Then they get upset when the students don't respond as they think they should. According to the catalog of a 5-year baccalaureate nursing program, clinical experience consists of 16 hours per week of laboratory experience and 2 hours of conference and clinic. This same program provides for medical surgical nursing practice that is, 6 semester hours. Maternal child nursing practice, 6 semester hours. Psychiatric nursing practice, 3 semester hours. Team nursing and ward management practice, 3 semester hours. At 16 hours per week, the total of clinical experience is approximately 3 months for the full nursing preparation program. The knowledge explosion of which we hear so much these days is not a myth, it's a practical reality. Academic programs in our schools of nursing must constantly be revised in line with these knowledge changes and additions. There is no way to put additional clinical experience back into our preparation programs. Thus, we are left with a critical question. Are new graduates actually ready for professional or technical practice? Many of them don't feel that they are, although a study of students in diploma programs shows a split about 50-50 as to the need for internship. Dr. Lucy Conant, in her article Closing the Practice Theory Gap, says that a nurse must know, and she must also know how to do. She further states that a scientific basis for nursing practice needs both kinds of knowledge, that obtained from experience and that gained from the intellect. Please take note of one obvious fact. Our hypothesis is that nursing needs confident, technically skillful, and appropriately knowledgeable and perceptive practitioners if quality nursing is to be a reality in both urban and rural areas. At the 3 levels of nursing preparation for registered nurses, the clinical experience opportunities are sharply curtailed so that some provision to enrich this aspect of nursing preparation must be devised in our judgment. In conclusion, let us ask you to ponder this simple question. Do you personally wish to be cared for by an attractive, beginning registered nurse who has not had an opportunity to grow confident and skilled through a postgraduate program of supervision when you go into anaphylactic shock, need tracheotomy care, are turned on a Stryker frame, have an IV started, are getting intermittent positive pressure treatments, have a Levine tube inserted, are catheterized, etc., etc., etc.? Let us not forget that the continual need to make judgmental decisions is the heart of the registered nurse's responsibility. Life and death are balanced in her hands repeatedly, not to mention degree and speed of recovery, including that subtle something, the patient's state of mind. Someone has said, when I hear it, I forget it. When I see it, I remember it. When I do it, I know it. Let us face the need for all graduates of programs preparing registered nurses to have 1 year of internship. Thank you.
Our first negative speaker, Mrs. Irwin.
Madam Chairman, respected opponents, nursing colleagues, I cannot dispute the fact that new graduates from all programs preparing registered nurses have learning needs. Learning is a continuing need of all nurses. Why are the new graduates singled out for this type of additional practicum? What about the nurses returning to practice after long or short absences? What about the guidance and support that all RNs need on a continuing basis? Learning needs are highly diversified among individual practitioners and among graduates of various basic programs. To suggest that one program for one group of practitioners would even touch these needs is naive. The scope of learning needs of new graduates and experienced practitioners can never be constructively met through nursing internships. The most that nursing internships could hope to accomplish is to meet a few needs of the hospital in facilitating nurse adaptation to a system. The realization of enriching quality and quantity of nursing care can only be delayed and ultimately damaged by actions which would treat troublesome symptoms without being attentive to the underlying causes of these symptoms or the future ramifications of the treatment. The proposition before us is specific in two respects. It suggests that first, all graduates from all types of programs need an internship, that is, an additional training practicum. And secondly, that a specific time period of 1 year is needed. What will this magical 1 year do to increase the quality of nursing care? Just what is the optimum length of formalized practicum that will achieve the desired results? Graduates who would be entering these internships have already spent varying amounts of time in supervised practicum. Yet, according to the proposition, 1 additional year is needed by all of them. Educational objectives of all programs indicate the expectation that graduates are capable of beginning competency at the technical and/or professional levels. To dictate an internship following the completion of such a program says these graduates are not capable. Therefore, this implies that either the educational objectives of our programs are not being achieved or the definition of competency is in question. If the educational objectives are not really achieved, would it not be more reasonable to critically examine each program and the accuracy of its evaluation procedures? If, on the other hand, the objectives themselves are seen as deficient or incompatible with service demands, it is only common sense to examine the existing educational and service systems individually and together in terms of the total system which dispenses health services. If learning needs of new graduates are so intense, immediate, and different from other nursing practitioners as to warrant a mandatory extension of the basic programs, we suggest that this may very well be a function of the discrepancies in the expectations of nursing service and education. Would this discrepancy be alleviated by prolonging students' programs? It would not. The internship in this respect would provide one of two distinct educational experiences. One of these would satisfy education and the other one service. Incompatible goals would be perpetuated and students as well as graduates would continue to be caught in the middle. A postgraduate internship has the potential of recasting educational and training models toward a standardization of practice rather than selective utilization patterns. There is no reason to believe that internships would define utilization procedures in hospitals any better than the clinical assignments of basic students has. What it does suggest is that all graduates would be trained to effectively meet the traditional demands of our hospital systems. Such standardization can only perpetuate the bureaucratic organization which continues to be a major hang-up in the effective dispensing of health services. The unpredictability and variety of the human component around whom the tasks of health care are defined is infinite. Therefore, most of nursing consists of these dynamic tasks rather than static, inanimate, mechanical tasks. As I understand Richard Scott's discussion of organizational theory in this regard, attempts to develop error-free resolution of dynamic tasks through bureaucratic administration are doomed to frustration and ineffectiveness. These tasks must be dealt with through flexibility for decision-making at the situational level. Workers cannot be expected to develop a sameness of potential in speed and action as they might on an assembly line packaging toothpaste. Expertise is only developed through the exercising of individual abilities at a pace most conducive to the growth of that particular individual. This alternate action calls for the opportunity for professional practice, which is supervised by active, competent professionals and not by procedure and policy books. Evaluation and validation at the situational level are necessary ingredients. These ingredients determine individual responsibility levels and encourage interaction of experience and idealism within a structure which itself is open to innovation, flexibility, and change. I might add that this latter system also accepts the initial clumsiness and inefficiency of its novices. Quality resolution of these dynamic tasks, of which much of nursing is comprised, cannot be effected through a simple, terminally defined practice period for newcomers into the service area. In fact, practice, as is possible and probable in the internship, would only help to maintain the status quo of bureaucratic organizational systems which plague efforts for professional practice. The following additional and unintended consequences might also be anticipated if internships were to be established. First, it would be very tempting for educators to de-emphasize clinical application of theory during basic programs. Complacency in attaining educational objectives, as well as critically evaluating clinical competencies, could be encouraged by, and after all, there is still one whole year just for application outlook. Secondly, there would be an additional drain on supplies of people prepared to give the kind of supervision such a program would demand. This attention we feel, and we're sure that you feel, can be more productively spent on the education of basic students, graduate students, and in the clinical areas, demonstrating, encouraging, and facilitating professional practice for all of our registered nurses on a continuing basis. This is a right that we all have. Thirdly, the instituting of nursing internships could succeed in further depleting our manpower resources. Highstand puts it this way, quote, "Quality has often been equated with training and skill, rightly so, but improved quality has often been equated with longer training programs. Since the length of training is a crucial incentive, attempts to improve quality through longer training programs are self-defeating, adding to the difficulty in recruitment of more and better applicants," unquote. Finally, the idea of an internship for nurses parallels most closely the medical model. It's interesting that since the advent of clinical clerkships in medical schools and other educational trends similar to those supported by nursing for some time, our colleagues are seriously questioning their need to continue internship programs. Why then does this suggestion now come up in nursing? One reaction was stated by Montag and Godkin a few years ago. Hospital administrators have expressed considerable interest in the internship. This is understandable, as an internship would assure them of the services of a given number of nurses for a year, and then easy replacement with succeeding groups of interns. That the internship is ripe for exploitation is all too evident. Fellow nurses, the internship is an outmoded model of training that is out of step with current nursing needs and future demands. Please consider carefully, what would nursing internships really do to upgrade nursing practice and patient care? Thank you.
We are now ready to hear our rebuttal. Our second affirmative speaker is Ms. Joan Willis.
my friends. As I listened to Mrs. Irwin, I heard her really say that what we have now is great, and it doesn't need any change, and that everybody is satisfied with it. We don't agree, obviously, or I wouldn't be standing up here. Let me attempt to respond to one or two of her specific points. First of all, why internship for beginning RNs, but not for RNs who are returning to practice? I'm from Colorado, and we're blessed in Colorado with an excellent and well-established refresher course program that not only works wonders in terms of restoring confidence of those returning to practice, but does amazing things in terms of getting people back, often on a part-time basis, into active practice, running somewhere from 60 to 80% of the people who take our refresher course programs. When we talk about an internship program, we aren't talking about the kinds of refresher experiences that certainly people returning to practice need. We're talking about acquiring basic skill in practice competencies. Let's be clear on one point. We are not saying that the educational procedures in nursing preparation now are not good. We are simply saying that in terms of practice, it has not been possible to go far enough to permit the kind of individual experience that every one of us needs to feel confident in what we're doing. It's interesting that particularly in baccalaureate programs, some of the authorities are stating that these people are going into teaching and going into public health and going into school nursing. I'm a school nurse. You can laugh at that. Going into every area except hospital nursing, where you have to know how to do. I resent the statement that people who can't do go into teaching, because as a school nurse, I know some marvelous master teachers. But nonetheless, I think in some respects we must recognize that perhaps this is where people go who can verbalize but who can't perform. Now, is there a gap? Do you think there's a gap? We believe there is a gap between theory and between practice. If current education evaluations show that preparation programs are entirely adequate for beginning RNs to function well and competently on a practice level, why is it that overwhelmingly students, particularly in AD and BS programs, do not believe this to be true? Let me read for you one or two of the comments made by, of course I don't have it here now, but Catherine Lawrence, who was a diploma school graduate and then went on to baccalaureate school, now is working on a master's, took a while to establish rapport with her fellow students in the baccalaureate level program, and the thing that finally came through to her was that the people that she was in school with were overwhelmingly concerned with their practice competencies. This is what worried them routinely from the time that they began to face that awesome moment when the responsibilities would be theirs as graduate nurses, not as student nurses. If we have a bureaucratic system, it's time we did something about it. And in some places we do. Nursing services on one side of the fence and nursing education is on another. Don't we have to bring them together? Emily Campbell thinks we do. In the journal article of May 67, she said, proponents of joint positions believe that one must practice nursing to maintain clinical competence, and that in order to teach nursing, one must be an effective practitioner. Were our students individualized nursing care plans anything more than academic exercises, she says. Let me just share with you one final paraphrase of John Gardner's familiar passage in his book, Excellence. The profession which scorns excellence in practice because practice is a technical activity and tolerates illusions in educational philosophy because it is a theoretical activity will have neither good practice nor good education. Neither its practice nor its theories will promote quality nursing care.
We will now hear our second negative speaker, Mr. Chow.
Our opponents claim, 1, all new graduates lack sufficient academic and clinical preparation for beginning nursing practice, and 2, they advocate a 1-year internship not identifying specific objectives, seemingly denying differences in educational preparation or experiential background. We reject these ideas. My partner has stated, 1, that educational objectives of all programs indicate graduates are capable of beginning competence. 2, that the discrepancy between the expectations of nursing education and nursing service exists because of a lack of clarity in job expectations and a lack of constructive professional supervision on a continuing basis. 3, that internships are a service-oriented, outmoded concept, not an educational one. 4, that they will not meet the needs of all graduates. She offered an alternative plan, sound orientation to the position to be assumed. I will elaborate on our contention there is no need for the one-year internship for all graduates. I will elaborate on the alternate plan. We reject the idea of need on the basis that the graduate is prepared. State laws without exception require completion of an approved program of theory and practice and successful completion of a licensing examination in order to practice. We would agree with Reeder and Schwartz as they describe a new graduate thusly: prepared but inexperienced, beginning a new career. We reject the idea of 1 year for all on the basis it denies individual differences. We reject a 1-year internship because it delays specialization. As the generalist, for all new graduates are generalists, participate in this 1-year internship. It adds an apprenticeship period which lacks continuity and integrity with past educational experiences. It will present problems to nursing service in terms of cost of supervision and in administration. It is a time-oriented, not an individually oriented concept. It is a task-oriented, not a role or position-oriented concept. If added to provide experience until all of the task-oriented procedures in care are mastered, it would take a lifetime, not a year. We disagree that 1 year is necessary, and we believe that Mrs. Myers agrees with us, because in her January 1968 AJN article she states, if properly supervised during the first 6 months of employment, these graduates render safe and efficient care. We propose an alternate plan calling for modification of the status quo, modification of existing orientation programs. New graduates need well-planned orientation, focusing on that which they bring and the position to be assumed. Such program considers the following. There are 3 programs preparing registered nurses. They differ. 2, there are 2 types of nursing practice, and job descriptions must spell out the expectations of and the educational preparation and or equivalence for each position. 3, the background of the employee and the position must be matched. 4, the individual learning needs of each new employee must be ascertained and met, for jobs and new employees are seldom tailor-made. And last, the orientation period should cover the time required for individual adjustment to the new position, which may take a few weeks to 3 or 4 months. Give new graduates these opportunities, and the response that they will make will be even more overwhelmingly, yes, we like this. We of the negative contend that the proposition as stated is not valid, and we urge you not to accept it.